Hello, I'm Michelle Flemings, introducing you to a new clinically driven workflow that combines chart review and documentation. Comparing current state workflow on the left with future state physician workflow on the right, this is what we found. Current state physician documentation takes nearly 20 minutes, 46 tab hops, and over 120 clicks. In the future state workflow, the same task takes less than 3 minutes, 1 tab hop, and 25 clicks. Let me show you how. What you see here is a 3-column contextual view of the patient record that places the information you need most face up. This supports chart review simultaneous with creating your note. Using this new workflow, the clinician opens a prior consult note to quickly tag and drop information into the history of present illness. No longer do you need to use a separate autotext or multiple tab hops to launch out to other parts of the patient record to find the social, family, past medical, or past surgical history. New functionality imports this information to your note automatically. After 1 minute 35 seconds in the current state, the clinician has opened an autotext, erased it, then opened another autotext prior to starting to document the encounter. The physician then launches into the clinical documents section, opens a progress note, copies, cuts, and pastes the information into the history of present illness. The provider opens the clinical documents tab again, this time choosing an admission history and physical from which the past medical and surgical history, family, and social history are copied. This information is then added to the note using a combination of cut and paste and free text after 8 minutes 23 seconds and 17 tab hops. In consideration of your time, we did not include this process in our video. The future state provider uses autotext functionality to complete the review of systems, quickly documenting any positive responses. For the physical exam, the clinician uses an autotext with dropdowns to document abnormal findings and specify laterality. During the course of chart review, the provider tags a white cell count and a chest X-ray report. Next, our provider orders a repeat CBC and signs the order, all without having to leave the contextual page view. At just under 11 minutes, the current state clinician has completed the history and physical exam, as well the past medical and surgical, social, and family history, then launches out to the radiology results tab. After 4 tab hops, the provider copies a chest CT report and returns to the current consult note. Satisfied with their chart review, the future provider now chooses the appropriate note type. The new 2-column view, with your documentation on the left and pertinent past history and diagnostic results on the right, is the framework of your final note. Here you can see that the past medical, surgical, family, and social history pulled into the note automatically. Because it is discrete data, the previously tagged white cell count was automatically added to the lab section of your note. The physician then adds the chest X-ray report from the clipboard to the diagnostic radiology section. After final review, your note is ready to be signed. This new clinical workflow is customizable based on individual provider, specialty, and counter type, working with you so that you can move on to what's next. Dictation, free text, and autotext are all supported, so the choice of how to document is yours. The 3-panel contextual view puts information that is important face up, making chart review much more efficient. The result is an agile solution that flexes to work the way you do. Using the current process, the note takes 20 minutes, 46 tab hops, and over 120 clicks to complete. As you see, using the new clinically driven workflow, your note is signed and complete in less than 3 minutes with 1 tab hop and 25 clicks. Thank you for watching.